Going back to 2010, inspectors from the Ministry of Long-Term Care issued dozens of written notifications and dozens of compliance orders after discovering many problems at Grace Villa. A quality inspection report dated August 3, 2017 found 32 areas of non-compliance with the Long-Term Care Act alone, resulting in 21 written notifications and 3 compliance orders, including one that found a contracted staff member physically abused a resident. It was confirmed that the employee's actions were abusive and that the resident was not protected from abuse by anyone. The report identifies a history of noncompliance in protecting residents from abuse. The scope of the noncompliance is a pattern. The history of noncompliance is ongoing, with a compliance order previously issued January 27, 2016. Inspectors also found the call bell system wasn't working and a staff member had taken money from a resident's wallet.
Any abuse is unacceptable, but repeated abuse is a much bigger problem.
Pat Armstrong is a long-term care researcher who says regular inspections are not enough. Meaningful enforcement is needed with real penalties for problematic homes.
We need people to be in there to make sure that they're actually doing it and to help them do it, to give them direct instructions.
The following year, another quality inspection report dated November 28, 2018 found a dozen more problems, including an incident where a staff member was verbally and emotionally abusive to a resident, resulting in another abuse compliance order. The home did not ensure that resident 31 was protected from abuse by staff 116. Other reports indicate residents were left alone when they shouldn't have been, resulting in injuries and failures to prevent residents from falling. Concerns about food quality, maintenance, cleanliness, and improper administration of medication. Some of these issues date back as far as 2006. Armstrong says Grace Villa isn't the only home with problems like this.
It's not an isolated case, but it's not the case in all the homes.
In a statement released when the deadly outbreak at Grace Villa was declared over last week, the CEO of Grace Villa's operator, APANS Health Services, said, "Together, we are continuing on a path to enhance and maintain our legacy of exceptional resident care at Grace Villa. Right now, Hamilton Health Sciences are managing the home as part of a 90-day voluntary management agreement set up in response to the outbreak. Given the home's history of problems, we asked Public Health if they have any concerns about Grace Villa's ability to follow COVID protocols and prevent another deadly outbreak once HHS is out." Medical Officer of Health Dr. Elizabeth Richardson acknowledged the history of problems and wrote she's hopeful the operations of Grace Villa will improve in the future during the pandemic and beyond. Without the proper COVID-19 protocols in place, the risk of going back into outbreak is high. We also asked Hamilton Health Sciences and the Ministry of Long-Term Care if they have any concerns about Grace Villa's ability to operate on their own. HHS says that they've made considerable progress with the team here on site and that the end of the term is still a far ways off. The Ministry of Long-Term Care didn't really answer the question, but they say that they're committed to helping Grace Villa in whatever way they can. I should mention that we reached out to Grace Villa for an interview on this topic, but nobody returned our requests.
All right, and Matt, lots of documents to go through. Of course, I watched you do it. How hard are the inspection reports to understand?
You know what, Phil, they are difficult to understand. There's a lot of jargon, a lot of references to the Long-Term Care Act. It's difficult for an average person like me to really get a clear picture. And that's something I talked about with Pat Armstrong, the researcher you saw there in my story. She said that these reports are supposed to be for the public. So they have an idea of what's going on inside homes like Grace Villa. And if they're not easy to understand, then they're not really serving their purpose. I asked the Ministry of Long-Term Care about that, about her thoughts on that, and they didn't provide me with a comment.